in pursuit of health and wisdom. Sapio with Buck Joffrey.
Welcome to Sapio with Buck Joffrey. This is Buck Joffrey, and today I am going to talk to you about a topic that, well, it might bum you out a little bit. I'm going to talk to you about sexually transmitted cancer. Yes, indeed, you heard that right. Sexually transmitted cancer. It is a real thing. This is probably going to be a big shock to many of you, but we've known about these kinds of cancers for a long time. Specifically, these are cancers that are the result of viruses that can cause cancer. What viruses are we talking about? Well, I'm going to hit on three major ones, and the first couple are not as common. Obviously, we have HIV, which is fortunately decreasing in incidence, is a little bit easier to prevent yourself from getting, as is hepatitis B, which is the next one I'm going to talk about. And then hold on to your hats for the most common of the sexually transmitted diseases that cause cancer that people don't know about, Human Papilloma Virus, which affects a huge number of people, and they don't even know it. Okay, so let's start with HIV. Now, the good news, as I mentioned earlier, is the HIV, as the numbers of people who get it, is going way down. I mean, obviously, it peaked in the 1980s. No one had any clue what was going on for a long time. It was described as like the gay disease and all that. It was crazy times. And then they discovered what it was, how it was transferred, and then it started to decline significantly in the 1990s as education went up, right? It was pretty stable, around 50,000 cases per year in the U.S. For the first 15 years of this century or so. And then in recent years, it's been declining even further, down to about 36,000 in 2021. Epidemiologically, meaning who gets this stuff? Men accounted for about 76.9% new HIV diagnoses, and women the rest, obviously. Of those men, it was primarily men who have sex with men. So gay men accounted for 70% of new HIV diagnoses in 2009. Certainly, heterosexual transmission is a real thing. It is less common for reasons I'll tell you in a moment, but heterosexual contact still accounted for 23% of new HIV diagnoses in 2019. And that's interesting because that's actually higher than it originally was, 11% beginning of the whole thing. Well, that actually kind of makes sense if the number of gay cases are going down. So why is it so much more common in gay men, you might ask? The reason for that is there is a significant increase in susceptibility to the virus with anal sex. Okay, the lining of the rectum is thin, can tear more easily during anal sex, and that allows HIV to enter the body through these tears. And so that's a big part of it. There's also just the right kind of immune cells to get infected in that ecosystem in the anal area. So it's a perfect place for HIV to be transmitted from. Now, HIV viral loads tend to be higher in semen than in vaginal fluids, and that's one of the reasons why that increases the transmission during anal sex. Anyway, as far as cancer goes, HIV is not thought to be something that directly causes cancer, but it works by weakening the immune system. And as you may know, small numbers of cancer cells really can be present in a person at various times in their life, but the immune system, a healthy immune system, usually takes care of that. Well, if your immune system doesn't work well the way it does when somebody has HIV, then you have a proliferation of cancers. So people with HIV obviously have a significantly higher risk of developing rare ones too, like Kaposi sarcoma, which is a very rare skin cancer, non-Hodgkin's lymphoma, cervical cancer, lung cancer. You know, there was a study published in the Journal of National Cancer Institute that found individuals with HIV that they had a 2 to 3 times higher risk of developing certain cancers compared to the general population, even after counting other risk factors like smoking. Now, curiously and interestingly, even in those people who are on antiretroviral therapy, who've got their HIV under control, they still have a higher risk of developing cancer than people who don't have HIV and also have an intact immune system. So anyway, that is kind of the deal there with HIV. And the good news about HIV, though, is an incredibly preventable disease. Condoms used correctly, for the most part, wipe out the risk. In addition, it's interesting, this is something that is available that people who are at higher risk, like for example, gay men, there are prophylactic drugs out there right now that if people are on them, they're believed to give you about a 99% of efficacy in terms of preventing transmissions. So bottom line is, between condoms and these prophylactic drugs that people can take, if they have high-risk sex, I mean, you should be able to stay out of harm's way when it comes to HIV, right? That's a good thing. Now let's move on to hepatitis B in particular. Hepatitis B is a disease, is associated with liver cancer. As it turns out, about 38% of hepatitis B cases are thought to be sexually transmitted. I have to tell you, actually, that's higher than I would have thought, but that's what the statistics are. So you can get this from, unprotected vaginal, anal, oral sex with an infected partner. The risk is higher, again, with anal sex due to that whole potential tearing and bleeding issue that I mentioned before. And so that's sort of a recurring theme. Oral sex does appear to have a lower rate of hepatitis B transmission than vaginal sex. And using condoms and dental dams can reduce but not eliminate the risk of sexual transmission of hepatitis B. The link between hepatitis B infection and liver cancer is the most worrisome thing. The World Health Organization estimates that chronic hepatitis B infection is associated with over 300,000 liver cancer deaths per year globally. The way that happens, by the way, is that the hepatitis infection itself causes complications in the liver like cirrhosis, which is basically scarring of the liver. And that scarring eventually progresses to liver cancer. And again, that's really difficult to treat and has a very, very poor prognosis. Again, about 38% of this is being sexually transmitted. And of course, the rest of it is not. And the reason I didn't realize that it was as high as that is because I remember it was a thing. Certainly, as a surgical resident, they required us to have all of our hepatitis B vaccinations before we operated, because you could easily get hepatitis from cuts and surgery. Luckily, by that the vaccination for hepatitis B is really effective, and it really did not seem to be an issue. I certainly didn't know anybody who got a hepatitis B from any kind of cuts or anything like that. But, the vaccination was helpful in that regard. It's basically really effective in reducing disease burden and blocking transmission. So if you're not vaccinated with Hep B, you might want to consider it, whether or not you are sexually active. I mean, it is kind of a disease you don't want. I mean, it's kind of an avoidable thing because the vaccine, and liver cancer is a horrible, horrible cancer. So one that you might want to avoid. By the way, the biggest thing we feared in surgical residency 15 years ago was not HIV like you might think. I mean, I was at San Francisco General Hospital for part of my residency where, there was an extremely high rate of HIV positive patients that would come in with traumas and stuff like that. And we weren't really worried about that as much as we were worried about another type of hepatitis called hepatitis C, which is worse than hepatitis B when it comes to, its cancer-causing prowess. And at that time, there was nothing you could do with hepatitis C. If you got hepatitis C, there was no vaccination for it. There was no treatment or anything. Remarkably, though, now there's treatments that can actually completely eradicate Hep C, which is a huge, huge discovery, huge win. I got to tell you, people don't give medicine enough credit sometimes. A lot of these things, they're diseases that are just killers, and they come and they're, ravage people. And the next thing you know, we have a cure and we forget all about it. But Hep C is one of those things that, we don't have to worry as much about anymore because there's actually a cure. By the way, Hep C is not really thought to be sexually transmitted. It's kind of weird. I don't understand why that is the case. Apparently, it can transmit a little bit with anal sex for the same reasons, cuts, tears, all that kind of thing, but it's really not considered a sexually transmitted disease, curiously. Okay, now I wanted to get through those, but the one I really, really want to talk about, because I just feel like it's so important, and for people to understand it, it is such a major avoidable thing, is human papilloma virus infection, because human papilloma virus infection is associated with lots of cancers. It is one of the most common sexually transmitted infections worldwide, and it's really responsible for a lot of disease burden and cancer cases. So according to the American Sexual Health Association, human papilloma virus is responsible for 90% of anal cancers, 70% of vaginal and vulvar cancers, 60% of penile cancers, and 60 to 70% of oropharyngeal or throat cancers. Okay, so oropharyngeal cancers, this is really interesting because this is one that people probably don't really recognize at all. Oropharynx is the back of the throat. Back of the throat, tonsils, base of tongue. So there's lots of people who have this kind of cancer, like the late Eddie Van Halen, actor Michael Douglas. You know, most women probably know more about HPV, human papilloma virus, as a cancer concern because, you know, that's why they do yearly, you know, with young women, they get the frequent pap smears. They get the papillonicolaus smears, which basically are looking for changes in the cervical mucosa and are looking for, you know, HPV virus as well. So persistent HPV infection over time is a key factor in the development of cervical cancer. And back in the day when there wasn't anything we could do in terms of, you know, when we didn't really know that as much and there was not a vaccination, this was a really, really big, much bigger problem, cervical cancer. I should have looked up the numbers, but I know it's gone down a lot. But I will say that just in terms of understanding the role there of HPV, in the Journal of Oncology, there's a large prospective study, 20,000 women. They followed them for an average of 16 years, and what they found was that 10% of the high-risk HPV cases ultimately progressed to cervical cancer if left untreated. So that's a lot. That's a lot, especially when you realize how many people actually have high-risk HPV. So I mentioned high-risk HPV. Okay, so there are different strains of this human papilloma virus. And, you know, they're like numbers. You can be like, 5, 6, 11, 16, 18, stuff like that. Anyway, there's a few that are classified as high risk, like 11, 16, 18. And those are responsible for about 70% of cervical cancer cases globally, according to the World Health Organization. So you may be asking yourself, how many people actually are carriers? How many people have high-risk HPV types that they're walking around with, those associated with cancer? And the answer to that is going to blow your mind. It's about 20 to 25% of both adult men and women, okay? Now, most of the time, as you can imagine, because these numbers are so big, most of the time the body clears these HPV infections just fine. They tend to not lead to cancer. However, persistent infections can cause changes ultimately that lead to cancer. Now, what can you do about it? Well, condoms, you can use condoms. They're about 70% effective against HPV, which is, it isn't great. It's certainly not as good as like, the numbers that you see with like HIV and stuff like that. But here's the thing, and this is what this is really about for me right now, and the message I'm trying to get to you. The vaccines are highly effective. They're highly effective at protecting against most of the HPV-related cancers, again, including cervical cancer and those throat cancers that I mentioned. There was a systematic review and meta-analysis that found that human papilloma virus vaccination, and the vaccination itself is called Gardasil, by the way, and that the vaccination led to an 80% lower risk of oral HPV-16 infection, which is the main cause of oropharyngeal cancer, compared to unvaccinated individuals. All right, that is huge, 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 huge. On top of that, right, there was a groundbreaking study from India that was published in 2018 that showed really, really remarkable efficacy of HPV vaccine, even with just a single dose. I think it's normally done in, a couple doses, but this large prospective cohort was followed. There was like 17,000 girls aged 10 to 18. Here's the interesting thing here. They evaluated the vaccine efficacy against persistent HPV 16 and 18 infections. In other words, girls who were already infected and they had these infections that were not cleared, right? And again, that's the kind of infection that we worry about because those are the ones that end up potentially leading to various types of cancer. Now, interestingly, the study found that even a single dose of HPV vaccine provided a 95.4% efficacy against persistent HPV 16 and 18 infections over a 10-year follow-up. Okay, that's huge because you think normally about vaccination as, well, especially before COVID, you always thought about, like, at least I did, you'd think about vaccinations. Well, gosh, you're vaccinated and, if you already been exposed to something, there's no point in getting vaccinated to it. Well, here, what they're showing is there absolutely is a reason to get a vaccine, even if you've already been infected with it, right? Because it's basically showing that there's this huge protection for people who get the vaccine, even when they're infected, of it going on to develop cancer. Again, that's just with one dose too. Even though there was I think that the normal thing is 3 doses of Gardasil, by the way. Now, here's the thing I don't like. Okay, here's the thing I don't get. I remember I was actually head and neck surgery resident, head and neck surgery, seeing a lot of these oropharyngeal cancers and all that kind of thing, HPV related, back in 2006. And I remember when they announced this vaccine, it was such a really big deal. And at that point, they actually were only recommending it for girls. And I'm like, why would you just recommend this for girls? It makes no sense at all because they were really focused on, I guess, cervical cancer and all that thing, and really were ignoring oropharyngeal cancer. And then on the other hand, even if you kept that in mind, it just doesn't make sense because where are the girls often getting it from? They're getting it from the boys, right? So anyway, they changed that. Now it is recommended for adolescents, boys and girls 11 to 12, which is great. What's interesting to me and what I don't like is they basically recommend this up to about age 26. They say you can catch up. You can do a catch-up vaccination through age 26. And it seems awfully arbitrary to me, right? Because the research indicates that the vaccine can still provide significant protection for those with previous HPV exposure. So why would the limit be 26? It makes no sense to me at all. Because the thing is that these cancers that develop from the persistent infections, they don't happen like 2 years later. They happen decades later. So if you've got some sort of HPV infection brewing that could end up with cancer, and the vaccination could potentially knock out that persistent infection, why wouldn't you get the HPV vaccine? That's what I don't like about some of these guidelines, okay? Now, certainly what they find is that maximum protection from these virulent, HPV cancer-causing viruses, it's achieved best when vaccination is before exposure, right? Before somebody actually gets HPV. Then you're going to get the maximal benefit from the vaccine. But obviously, I just told you about a study that there was a huge benefit for girls who were already infected with this thing. Just to reiterate what I'm saying, Gardasil, it can protect against persistent infection with the same HPV types that you're already infected with. Like, say, for example, you already have HPV 16 and you get a vaccination with Gardasil, which protects against HPV 16. There appears to be some sort of process of cell-mediated immunity that kicks in that helps you get better protection and helps you clear that particular infection away, even if you already have it. And the other reason to get it is obviously, if there are multiple viral HPV strains that can give you cancer and you have 16, but you don't have 18, it'll protect you against that. So in my opinion, a lot more people should be getting this. I mean, people are living longer, remaining sexually active later in life, and the risk of acquiring new HPV infection, it persists in the middle age. I mean, shoot, there does not appear, in my opinion, to be a strong rationale for a strict upper age limit on HPV vaccination. There really doesn't. I mean, if you are in your 40s and sexually active, probably, in my opinion, should seriously consider getting vaccinated. So, in my opinion, again, you check with your own doctor, I would suggest that anybody, not only who's sexually active, but who has been sexually active in their life, and who's not been permanently monogamous with somebody else who was permanently monogamous in the same relationship their entire life, seriously consider talking to your doctor about getting a vaccine. I'm not going to give you medical advice because even though I am a doctor, I don't want you to say I gave you medical advice and sue me for some reason. But I do think it's something to seriously consider. And and by the way, if your doctor has a good reason that you should not get the HPV vaccination if you've not already gotten it, let me know, because I can't figure it out. This is one of those policy things that I feel like a lot of it's based on big numbers and that kind of thing, but it really doesn't look at individual risk. And you know what your own risk probably is. You've been more sexually active in your life or less sexually active in your life, or maybe you still are, maybe you're still single and you're not under 26. I mean, to me, it's just it's one of those things. It's about making this a personal thing rather than just a big numbers game. I should point out, for the record, I am vaccinated, even though I was in my early 30s when this vaccination came out. And one of the reasons for that, by the way, is, I trained as a head and neck surgeon, and I saw these kinds of throat cancers all the time at UCSF where I trained. And so as soon as I saw an opportunity to be protected against these in any sort of way, I was all in. So anyway, I'm hoping that this message stops someone from getting cancer. And I'm not even kidding about that, because I think this is information that is so not in the public realm. If more people knew what the potential risk was and potential opportunity for preventing that, these kinds of cancers, that more people would get Gardasil. I also talked to Alan Viglione about this, who's my own personal doctor. He totally agreed with me as well. I couldn't think of a reason not to get this for adults. But let me know what you think. Shoot me an email, buck@sapiopodcast.com. And again, let me know if your doctor thinks I'm wrong and tell me why. That's it for me this week. For Sapio with Buck Joffrey, this is Buck Joffrey signing off.
Thanks for listening to Sapio with Buck Joffrey. A quick reminder that while I am, in fact, a surgeon, nothing I say should be construed as medical advice. Now, make sure to include your physician in any medical decisions you make. And also, if you're enjoying the show, please make sure to show your support with a like, share, or subscribe. Until next time, this is Buck Joffrey for Sapio with Buck Joffrey.